Welcome everybody to the joint replacement class. My name is Lisa Wishart. I'm the director of the Joint and Spine Center here at Holy Cross Hospital in Silver Spring, Maryland. We are going to learn today about how to prepare for your joint replacement. In this class, you'll learn about preparing for surgery, your hospital stay, the discharge planning, and preparing your home. This is a picture of what the prosthetic from a joint replacement for hip looks like. There's lots of information online, so if you really want to know more specifics, please do tap into those resources. And here's what the prosthesis for the knee looks like. We have an acronym of preparing. So in order for you to be successful, we want you to prepare for this journey of joint replacement. We have an acronym preparing. Preparing your home, reading your guide packet, exercising, practicing these exercises with your coach, attending a pre-op class. You can check this box off of your list of things to do since you're here today. Requesting pain medication, identifying your equipment needs, noticing your improvements, and finally going home. Regardless of whether you go home straight after surgery or go to a rehab facility, you are going to go home, so we want you to prepare your home for after surgery. Here are the members of your joint team. You've got the orthopedic surgeon, the anesthesiologist, the nurses up on the floors, physician's assistants, nursing assistants, physical therapists, occupational therapists, care management, or in some cases, social worker, coach is a very important person to help support you, and then the hospitalists. Your physician, if something medical should come up while you're here after surgery, will contact our hospitalists to consult and make sure that we're addressing your medical problems. Your coach can be anybody, your spouse, your child, your brother, your mother, your friend, somebody that you know is going to be able to support you in this journey. You may need more than one coach. Sometimes we know people's lives are busy, and so you may need to have a couple of coaches to help you through this recovery period. Your coach is involved in every aspect of your recovery and your care and your experience. We need to make sure that you review your guide packet and this PowerPoint with your coach. It would be nice if you and your coach were sitting next to each other while you're watching this video. Between your coach and yourself, you'll develop a team's plan. Transportation, how are you going to get to the hospital? How are you going to get home? Exercise, when are you going to do the exercises? If you're going to do the exercises, your coach is there to push you to do the exercises. Activity of daily living, this means how are you going to get into the bath, the shower, getting to the toilet. So something your coach needs to be part of this process. Medical history, medications, and meals. You'll need to go to your primary care physician and get a medical clearance within 30 days of your surgery. At this time, you'll want to make sure you have a complete list of your home medications so that when you come to the hospital, we can order them properly for you. For meals, I recommend that you prepare small meals so that when your coach isn't present, you can easily get yourself some food. Shopping. At this point, I usually tell our patients who are in the class that this is a time, if you would like a new sofa or a car, to please ask your coach to purchase one for you. But in reality, you're not going to be able to drive, so you're going to want to have somebody who can go and do whatever shopping you need to do. Important appointments and actions. You're going to need a pre-admission testing appointment with one of the nurses at Holy Cross, either in Germantown or here at Silver Spring. You can proactively make this appointment within a couple of weeks of your surgery, and the number is there, 301-754-8200. That's for Holy Cross in Silver Spring, and then the 301-557-6827 for the Germantown Hospital. In this appointment, the nurse is going to take down your history. She's going to write down what your medications are. She's going to let you know whether or not we have your medications here at the hospital. And then you will be able to meet with the social worker if you come in person. We prefer you come in person so you can meet with the social worker, build a rapport with them, and understand what your discharge needs are going to be. The pre-op testing visit with your primary care physician is a medical clearance to say whether or not you are ready for surgery. During that, your surgeon is going to ask for lab work to be done. This lab work can be done either in your primary physician's office, here at the hospital during your pre-admission testing, or at an outside lab. One of the lab tests that are very important for you to have done before you have surgery is a nasal swab. This swab is a swab that tests whether you have methicillin-resistant staph, and it is an organism that a lot of people carry in their nose. It doesn't give them any symptoms, but you'll want to be treated medically before you have surgery because the methicillin staph is a big cause of surgical site infections, and we want to make sure that you don't get a surgical site infection. Just as a side note, very few surgical site infections occur anymore. The techniques are great. You're not in the operating room as long, and so we have very few surgical site infections. As far as a dental exam goes, it's not required for you to go to the dentist within a year, but we suggest it because there's a couple of reasons. One, with you having a joint replacement, you may need to go on preventative antibiotics before you have any kind of dental procedure. The other reason is you can imagine if something all of a sudden occurred in your mouth wasn't healthy before surgery, you've had joint replacement, and you emergently need to go to the dentist, you're going to have trouble. It's not going to be very comfortable for you to sit in that dentist chair. It might be hard to get to the dentist, so please make sure your mouth is healthy. Preparing your MOLST form is a form that we have for it's a medical form that is kind of like an advance directive. It talks about what things you want done in case you can't make those decisions. This is a form that we have at the hospital that would follow you if you went to rehab. All right, here we have exercises that you want to do before surgery. You need to practice these exercises because after surgery you're going to do them quite often. And you want your brain to know what your body feels like when you do these exercises. You're going to have some muscles accessed when you're having the surgery, and it's going to be difficult for you to be able to do these exercises like you would normally. I recommend that you do the exercises on both your operative and your non-operative leg. So the first exercise is ankle pumps. I want you to go ahead and do that with me. You're going to flex and point, flex and point. Keep doing that. You can repeat that 15 times, 2 different sets. If you start to have pain, feel short of breath, any kind of symptoms that are not normal, healthy symptoms, please stop. The next exercise is your quad exercise. Your quadricep is a very large muscle at the front of your leg, and so what you're going to do is tighten this muscle. You can do it 2 ways. One is if you're laying down on the bed, you can push your knee down to the bed, and that will tighten that muscle. You can feel that as an isometric exercise. The other way is if you're sitting in the chair, just lift your foot up off the floor ever so slightly with your foot flexed, and you can feel it tighten that muscle. Then you have the gluteal set. So you want to have an opportunity to squeeze that. You can do both cheeks at once, one cheek independently, but that will tighten and work your gluteus muscle, which is an important muscle for ambulating. Chair push-up. The chair push-up, as you can see here, is an exercise that you don't realize you need to do. So your legs are very important in getting you up out of a chair. And since you'll have one leg that doesn't work quite as well, you're going to have a little bit more difficulty getting up out of the chair. So what I want you to do is practice at home with an armchair, leaning forward and pushing up with your arms. Your arms, in order to do this effectively, are going to need to be strengthened. So what I want you to do is some dumbbell curls for your biceps, some tricep curls for your triceps, and some deltoid exercises. If you have shoulder problems, please don't do the deltoid exercises. These exercises should be done either with a band, cans of soup, weights if you have it. Please practice that. I know that I've had patients who said that they didn't practice that before surgery and they're sorry that they didn't. The day before surgery, you want to follow your eating and drinking guidelines. Follow the guidelines given to you by the pre-admission testing nurse. Some physicians' offices have paperwork that might be dated and it won't tell you exactly how you're supposed to, when you're supposed to stop eating and when you're supposed to stop drinking. What we know is that you should stop eating any solid foods after midnight, and that 4 hours before your surgical start time, you need to stop drinking. So between midnight and 4 hours before your surgical start time, you can drink clear liquids, and that would be apple juice, plain tea, plain coffee, although I don't recommend caffeine at this point, Jell-O, anything that you can see through. Then you'll also want to do a review of your medications. As I said before, get a complete list of your home medications with the dose, the times, how often you take them, the name of the drug. For your convenience, what we'd like to do here at Holy Cross is provide you those medications at the time you're used to taking them, so we don't throw you off schedule in that day that you're here. So if you can provide us those times, that would be helpful. Check your arrival time. You want to make sure you arrive 2 hours before your surgery starts. Here at Holy Cross in Silver Spring, you need to arrive for a 7:30 case at 5:30. Our admissions desk opens at 5:30. In Germantown, it opens at 6, so you need to be here by 6. Registration, you arriving on time, is very important to making sure our surgical start times stay on time, because we don't want anybody to be delayed and pushed back. So we need you as part of our partners in arriving on time. Complete your packing list. You know, this is an anxious period of time. You don't want to have your packing left to the last minute, like I do many times when I'm going somewhere. You don't need that anxiety. So lay your clothes out, put them in a different room, put your suitcase out, and think about what you're going to need. Now, mind you, you're only going to be here for a day or maybe 2, so you don't need a large suitcase, just a weekender. And then we want you to relax and have a good night's rest. We don't say relax and have a good night's sleep because we know that may be unrealistic, but do your best. At least relax. If you're not feeling well, if you have a fever, if you have a rash, abrasion, or cut anywhere near your surgical site, you need to call your surgeon. We may need to cancel your surgery if you have any injury. Some people have skin folds and abdominal skin folds, and when you lift them up, there may be rashes under there. If you're having hip surgery, we may not be able to do it if you do have rashes underneath those skin folds. Remove your nail polish. This goes for toenail polish and fingernail polish. We check your circulation in your fingers and your toes, and the only way to do that is if you don't have nail polish on. If you pinch your fingernails, you can see why. You pinch it. When you let go, you can see the blood flow back into it. The amount of time that takes for the blood flow to come back is very important. Lay out comfortable clothing before you go to bed. That way, when you get up in the morning or you're ready to go, all you have to do is go put the clothes on. Comfortable clothing could mean anything loose fitting on the lower half of your body, something that's easy to pull on. It doesn't matter what you have on the top half. Then we will go through the complete CHG bathing. Before you do the CHG bath, you're going to shower before surgery. So do your showering for the first 3 days prior to surgery as you normally would, whether it's in the morning or the afternoon. The point of repeated showers is to wash the bacteria off of your skin. This bacteria could cause surgical site infections, so we want to make sure that you don't get one, so go ahead and shower. On the day before your surgery, you want to shower before you go to bed. What this means is you'll get in the shower completely with a hair wash, Let your skin dry after you get out of the shower. Use your CHG wipes. In the shower, don't shave or use any hair removal lotions, potions. Don't put any creams on after you get out of the shower. No powder, no makeup. We want you to change your bed linens so that when you get into bed after that shower, the day before surgery, you're getting into a clean, freshly laundered, sheeted bed. Put newly laundered pajamas on as well. Some of you may not go to bed with pajamas, and that's okay. But if you do, they need to be newly laundered. As I said before, the CHG bath helps to prepare your skin. This reduces surgical site infections, and you'll be doing it with these CHG wipes. You can avoid your ears, nose, mouth. And I will show you in a second the slide that refers to what parts of your body you should be cleaning. Here you go. There's 2 wipes in each packet. There are 3 packets in this packet. So 2 plus 2 plus 2 equals 6. So you should have 6 wipes. You want to use all 6 of them. Allow your skin to air dry after you've used them. It will feel a little tacky. We don't want you to rinse it off or put any lotions on afterwards. It's very important that these wipes do their magic to remove bacteria from your skin. Put your clean pajamas on then. Here's a picture of what parts of your body should be wiped. The first part is your abdomen, up to your neck and your whole torso and chest. The second wipe goes on each arm. 1 arm, 2 arms. The third wipe goes on 1 leg. The fourth wipe goes on the other leg. The 5th wipe goes on your back, and you may need some help to get your back cleaned. And the 6th wipe goes on the surgical site itself. So you will make circular motions in your hip area or your knee area to clean that an extra time. As I said before, let that air dry. It may be tacky, and then put your pajamas on. The day of arrival to the hospital. We mentioned 2 hours, arriving 2 hours before your surgical start time. 2 hours for a 7:30 case is 5:30 at Holy Cross in Silver Spring, and it's 6 o'clock at Holy Cross in Germantown. And I know that's only an hour and a half, but that's when their admissions desk open. At Holy Cross in Silver Spring, you can park in the garage or use the valet service. In Germantown, there's a parking lot on a surface lot. You do need to pay to park in Silver Spring. You don't need to pay to park in Germantown. When you come into the hospital, you're going to go to the front desk, which is the visitor's desk, and they will check you in. You'll tell them that you're having surgery, and your coach at that time will receive a visitor's pass. When you go to the registration desk, please sign in, and you will be asked to either immediately go to the registrar or sit down, have a seat at the front desk there. Don't sit there too long. Go back to the desk because we want to make sure your surgical start time is on time. At registration, they will confirm your contact information. They will confirm your insurance paperwork. They will take your copay. They'll scan all of this into your chart. You can submit your advance directive at that time or your most form. The advance directive is the part of your will that states what you would like done in case you're not able to make your own decisions. And then you will get your hospital ID. Once you've gone through registration, you will go to the ambulatory surgical department. In the ambulatory surgical department, the nurse there will take your vital signs. She'll confirm your contact information. Please make sure your contact information is correct. We've had times when the birth date's not right, the spelling of your name is not correct, the sex is not correct. So we want to make sure that you look all that paperwork over to confirm that it is correct. The nurse here will start your IV. She'll review your consent with you, and you will meet with your surgeon and the anesthesiologist in this surgical, ambulatory surgical area. Your second set of CHG wipes will be done at this time. You'll perform them just like you did the first set. If you need help, the nurse can help you with your back. Then you will go to the operating room. You will be in the operating room for about an hour and a half to 2 hours. That's not the whole time it takes for the surgery, but there's the setup time and getting everybody ready for your surgery. So let your loved ones know that you'll be there for about an hour and a half to 2 hours. In the surgical waiting room, there's a television screen that will show, using a patient code, where you are when you're in the operating room and when you're in the recovery room. So your loved ones can look at that to see how things are going. Anesthesia is different depending on the people. Everybody is different, so if you have any kind of history of any side effects or problems with anesthesia, you'll want to let the anesthesiologist know. There are different types of anesthesia used depending on whether you're having a hip or a knee surgery. Based on your medical history, the surgery you're having, your surgeon and anesthesiologist will review the type of anesthesia that's best for you. And as you can see, there's regional, which could be an epidural, a spinal, and then there are nerve blocks. Nerve block is usually used on a knee replacement. It leaves the leg numb for quite a while and provides good pain relief. After that hour and a half to 2 hours, you'll go to the recovery room. In the recovery room, the nurse will greet you. She will do many vital signs every 5 minutes, your heart rate, your respiratory rate, your blood pressure. She will start asking you about your pain. She wants to know what your pain score is at the time, from 0 to 10. She's going to make sure that she or he is going to make sure that you're as comfortable as you can be. Measuring pain can be very subjective. So we have a little pain guide and a pain score here. You can see the 0 to 10. It's associated with some faces in case you don't really know what number you are, and then there's descriptors underneath it so that you can kind of help us help you manage your pain. What you want to do is think about your pain being under control. After all, you've just had surgery. You cannot expect that you will have no pain. You are going to have pain, but we want to make sure it's under control. And one of the things that we do is have you establish a pain goal. Think about right now, you've been in pain for a long time, otherwise you wouldn't be coming here to have surgery. With that pain, what pain score from 0 to 10 do you need your pain to be in order for you to keep functioning, to go to work, to go out to dinner, to go to school? What do you need that pain score to be? And that's your starting point for your pain goal. It could change. We expect as your recovery improves that your pain scores will go down. But for you to come and say, I want my pain score to be 0 or my pain goal to be 0 is not realistic. And so we want to make sure you're being realistic. I would say that a pain score of 3 to 4 as a goal is probably appropriate. That will help us, the nurses, manage your pain. And so as we partner with you in managing your pain, we're going to try to get to that goal. If you're a patient who's a chronic pain patient, meaning you go to a pain clinic to be treated for pain control, please let your doctor know, because they will consult with our pain management department so that we can give you the pain medications that will actually work for your pain. Most of the pain medications that we give are very straightforward and they work just fine for patients. As you know, we have an opioid crisis going on here in the United States, so we are going to be very careful to not medicate you with more pain medication than you need. When we do medicate you, we are going to ask you what your pain score is. If you tell me your pain score is a 3 or a 4, I'm going to medicate you in the mild or moderate range. If you tell me your pain score is a 7, I'm going to medicate you in the severe range. If you tell me your pain score is in the moderate range, but you want medication for the severe range, I am not going to be able to give it to you. Now, we know you want to anticipate pain when you go do your physical therapy and your activities of daily living. But each time we ask you what your pain score is, we're going to medicate you with the pain medication appropriate for that score. If after you've done your physical therapy, your pain score goes up, and we've only medicated you for the moderate pain, we have pain medication we can give you to address that more severe pain. We want you to be proactive. So if you've been medicated for pain and you notice that the pain medication isn't working and you need to give it a good hour or so before it works, please call your nurse. Don't wait for her to come and reassess you. Let her know that your pain is getting worse. At the hospital, we have a pain brochure. The pain brochure will list what pain medications you're on, and on the back of it, there'll be a guide or a log that you can log in when you were medicated, with what time, when you expect to be medicated again. You keeping track of this medication will help you on discharge, and it will help us partner with you to medicate you effectively. And as you know, if your pain isn't managed properly, it could lead to more difficult recovery, and we want you to recover well. In the visitor waiting area, your loved one, your coach, family members are going to be waiting for you, for the physician to come and talk to you. PACU time, recovery time is about 1.5 hours to 2 hours. Please, coaches, family members, when your loved one is in surgery, go to the cafeteria, go to the Starbucks, get yourself some fluids and some food so that you're in good shape when your loved one comes out. Don't starve. There is a lobby and surgical waiting room on the first floor here at Silver Spring and on the second floor in Germantown. We have private rooms at both hospitals. As you can see, there is a bed and a sleep couch. The sleep couch is a nice place for your coach to stay so that they can be a part of your treatment. They don't have to stay there. They can go home, they can get rest. If you find that they may have a schedule issue where they can't be here all the time, they need to go to work, it's fine. We will take great care of them, but you're certainly welcome to stay. I do say that we have pillows, blankets, sheets for you, but if you have a favorite pillow, a favorite blanket, feel free to bring it. And remember to take it home with you. We have room service style dining. Basically, you'll get a menu and you can call on the phone to the dining room and they will bring you your tray. You have free wireless internet. On this big 42-inch screen TV, there's education channels for you, and we will be assigning you some exercises in your education channel, so beware, you'll have homework. You have video games, you have Comcast cable, so movies, and then there are other movies available for you. The most challenging times for you and the most important challenges you'll have is breathing. Breathing seems like a normal thing, but when you're up moving about, your lungs are expanding fully. When you're laying in bed, you've been sedated, you've gone under surgery, you're not moving about, your lungs do not inhale as much as they're supposed to or expand as much as they're supposed to. So we have to practice this incentive spirometer. Many of you know what this is, and it's the bane of your existence, but I'm going to tell you it will expand your lungs. So when you're laying there in bed, your lungs are just sort of collapsed like this. When you use the incentive spirometer, your lungs expand. So I'll do a little tutorial. You're going to blow out all of your air, put your mouth on the mouthpiece, inhale very slowly. Here is an arrow as to what your goal is. This plunger will rise to your goal, and so you want to keep practicing until you can get to your goal. You don't want to do it too quickly because it won't be effective. So this little ball over here is your measurement of whether you're doing it too quickly or not. When you start inhaling, the little ball will come up between the arrows and hover there. And that way you know that you're doing it correctly. You want to do this incentive spirometer 10 times an hour. I don't recommend that you do all 10 times at once because you'll get dizzy. Moving about in bed. Remember, you've only had one leg operated on. You have another leg and you have your arms and your body, so they can move, even though you might not want to move that one leg. Movement helps oxygenation, it helps skin healing, and so we want you to move around in the bed. However, we want you to always, always, always ask for help before you get up. you have not been cleared. If you've not been cleared by physical therapy to get up and move by yourself, you must call the nurse. Be proactive about this, because if you have to go to the bathroom, the nurse may be with somebody else, taking them to the bathroom. So please don't wait till the last minute before you go to the bathroom, before you call the nurse. Otherwise, there may be a delay. If you know you have bladder urgency, let the nurse know so she knows when you call, you've got to go now. Your family members cannot help you go to the bathroom. What's the number one, or where's the number one place a person falls when they're in the hospital? It's on the way to the bathroom or in the bathroom. So we don't want you to get injured, so please call us. And as our little saying goes, call, don't fall. What to expect during your hospital stay? We have a plan of care that's already established based on your knee or hip surgery. So we're going to be following that plan of care. Just know that everybody doesn't follow the plan of care at the same rate. So we will customize the plan of care to you specifically. But here are a few things that you will have done when you come to the hospital after surgery. The nurses are going to do your vital signs very often. That's your temperature, your heart rate, your respiratory rate, your blood pressure. They are going to assess your pain. Labs may be done, so you may have blood work done the day after surgery. There is an opportunity coming soon, perhaps, where we won't do the lab work, but right now, just remember, you may get blood work done the day after surgery. That's going to be to test to see whether you have bleeding. Bleeding is minimized these days because of the improvements in surgical technique and medication that they give you preoperatively. So very few patients do have to get a blood transfusion, but just have that in the back of your mind that you might. Sequential compression devices. Those are the Velcro sleeves that go around your calves, and they are attached to a tubing that's attached to a motor that pump and release, pump and release. And this helps circulation and helps prevent blood clots in your lower legs. We talked about the incentive spirometer, the dressing change. Your physician will change the dressing. Depends on when you had your surgery, when they'll change the dressing. They'll assess the dressing and decide whether it can stay on or should come off. Catheter. Catheter is a little rubber tube that goes into your bladder. Most people will have a catheter at some point during their surgery and recovery. I can't give you a clear-cut answer as to when the catheter will be removed. It will be removed, but just think, I might have a catheter. Knee immobilizer. If you're having a knee replacement, you're going to have a knee immobilizer. It's a full-length immobilizer so that you can't bend your knee. Once the block is worn off and once you're stable, the knee immobilizer will get thrown over in the corner. You don't need it anymore. Hip precautions depend on the approach that your physician takes, whether it's an anterior approach, a lateral approach, or a posterior approach. Ask your physician which approach he's taking and if there'll be precautions. And depending on the approach, there will be certain precautions you'll need to take. I can't tell you that now because I don't know the approach. Discharge planning. We like to have people out before noontime. So what we want you to do is plan, if you're going home that day, for your family member, your coach, to be ready to pick you up by 11 a.m. Our social worker and nurses and our whole team are working very hard to make sure that you have effective therapies and that you go home early. So you'll be fully apprised of the plan for your discharge. You will need 24-hour care for the first 36, 72 hours. That can be anybody that you know is going to stay with you. It can be your coach, but also you could have people that come to relieve your coach. We know that you're going to be weakened, you're going to have pain, you're going to be having a little bit of difficulty moving about, so we want to make sure you're safe. And in order to do that, we need you to have somebody with you for at least the first few days. You'll follow up with your surgeon in about 2 weeks. They'll let you know when they want you to make the appointment for follow-up. And your discharge instructions, including care of the surgical site, post-op pain, post-op nutrition, is an ongoing thing. And speaking of post-op nutrition, I really want you to start your post-op nutrition now. One of the things we know, when you have surgery, anesthesia, pain medication, you haven't eaten anything since midnight, you may have restricted your fluid intake, is that you'll become dehydrated, your blood pressure could go down, you'll become dizzy, and you're at risk for fall. So please hydrate. That doesn't mean hydrating with alcohol or caffeinated drinks, because those dehydrate you. So make sure you're hydrating with lots of water. Could be Gatorade if you like Gatorade, but hydrate, hydrate, hydrate. As far as food goes, nutrition, we want you to eat things with protein, vegetables, grains, things that will help you move your bowels, because as you're sedentary, laying around, having narcotic pain medication, you're going to become constipated. So we do give you a stool softener to help, but if you're one of those people that really has a hard time having a bowel movement, please let your doctor know so that we can go ahead and start giving you something that's more effective for stooling. Therapies are physical therapy, occupational therapy. These are a list of the things that the physical therapist and occupational therapists do.
Hi, good afternoon. My name is Richard Holly, and I'm the lead occupational therapist on the 8th Floor Joint and Spine Center. So I'm going to talk to you a little bit about what to expect from therapy and a few other things here in a moment. So first of all, I want you all to find that little booklet that says after your hip or after your knee replacement. All right, everybody got that? All right, fantastic. All right, I want you to turn to page 5 of the booklet. So now that you're at page 5, there's some exercises on that page that you should be doing. You're going to start doing them. You're going to be doing it with your involved extremity, but if it causes too much pain or discomfort, then you can stop. But you're going to be doing those a lot, so be very familiar with those before you come in. All right. The next thing is, how many doctors have had that conversation about the plan? First of all, how long are you expected to stay here at the hospital? Okay. Well, all right, don't shoot the messenger, but the message is that length of stays are not very long anymore. You're only going to be here about a day or less, or maybe 1 day. If you haven't had that conversation with your doctor, you need to go back and have that conversation. All right. The other part of the puzzle is, what are the plans for you after you leave the hospital? You should have had that conversation with your doctor. If not, I'm going to tell you what they are. Ideally, the plan is for you to go home. If you're doing everything you need to do to go home, we're going to support you in going home. If you haven't had that conversation with your doctor yet, you need to go back and have that conversation. All right. There may be some exception, and Lisa's going to talk about that here in a bit when she does the bulk of the class. All right. So those are the big things. Those exercises, discharge plans, and how long to expect to stay in the hospital. All right, a little bit about OT. If you turn to page around 10 or 11 in your booklet, it's going to tell you a little bit about the difference between occupational therapy and physical therapy. Essentially, occupational therapies, we're going to be working on your activities of daily living, those occupational life things, from getting out of bed, going and getting on off the toilet and out of the bath, or shower, dressing, bathing, those kind of things. A physical therapist is normally going to work more with you on those exercises I mentioned a little bit earlier that are on page 5 of the booklet. And also, they're going to be the ones who are working with you on your walking issues and stairs. And they'll make the recommendations for walking devices, crutches, cane, and walkers. All right, so that's one of the big differences between physical therapy and occupational therapy. But again, look at the page 10 or 11 of the booklet. If you have any questions, give me a call. If I'm not there, leave me a message and let me know why you're calling and that you came to the joint class and you have a question. I'll try to give you a call back as soon as I can. If it's not me, it'll be one of my cohorts that'll be calling you. The other big thing I want to bring to y'all attention, how soon does therapy start? Who doctors had that conversation? Yes, therapy actually for most of you all are going to start that same day. That means after your surgery, one of myself or the therapist are going to come see you, and we're going to try to do a little therapy with you that day. All right, we have to maximize the time we have with you. As I said a little bit earlier, the stays in the hospital are not very long. So again, when my therapist comes see you right after your surgery, greet them with a smile and say, yes, that good-looking guy at the class told me you would be coming to see me today. All right. So if you have any questions, Lisa's going to give you all my phone number, and I gave it to you a little bit earlier at the beginning of the class. If you have any questions, feel free to give me a call. If you have to ask about equipment, devices, things of that nature, give me a call, leave a message. If I'm not there, again, leave a message and I'll give you a call back. So quick review. How long do you expect to stay in the hospital? All right, 1 day or less. Discharge plan, home. Excellent. Yep, got it. All right, any questions? All right, thank you all, and I look forward to seeing you all when you come in for your surgery.
We have a gym on the units that are post-op. So we have a gym on the 8th floor here at Holy Cross and on the 4th floor at Germantown. You'll be using that gym with your physical therapist. You'll do some bed exercises with your physical therapist as well, but then they will be ambulating you or walking you down the hall to the gym to perform other exercises, including stair climbing. We're very concerned about your home being safe after discharge. So we're going to work on and give you some information about what the safest way to maintain your home and prepare your home is. Laura, our joint program coordinator, will come up now and talk to you about home safety.
Hi, my name is Laura Collins. I am the Joint and Spine Coordinator here at Holy Cross, both in Silver Spring and Germantown, and I'm going to talk to you a little bit about home safety. My training is a physical therapist. I've done both bedside, and most of my experience has been in the home setting, so I'm very versed as to what your needs are going to look like once you leave here at the hospital. First thing that you want to consider when you go home is your setup in your house. I want you to do a walkthrough and what that looks like, what kind of space is available to you. You will all go home and be discharged on a rolling walker, which is about 2 feet wide. So you want to make sure all your traffic areas that you'll be using after surgery will be wide enough for you to be able to get that walker through. Some of the bigger challenges at home when you're using a walker is to get through a bathroom door. A lot of our houses here that are older homes, the door jamb to the bathroom tends to be more narrow. So sometimes you have to go sideways through a door jamb with a rolling walker. So you want to make sure those paths are as clear as possible and well lit. Any area rugs that might be on the floor, you want to be able to pick up if you can. I'm not asking you to remove 8x10 living room rugs, but if you have runners or area rugs like in the bathroom or in front of your front door, those are a good idea to pick up after surgery. Because you're going to be on a walker, those rugs can get caught up in your walker, and we don't want you having any issues that could cause you to trip or fall. Other issues is that you want to make sure that your items that you will be using more frequently are at arm's reach. So I wanted you to take a look at the bathroom, at the kitchen, things that you're going to be needing have at arm's reach so that you don't have to reach too far to get something, because we don't want you to lose your balance. We want you always to be over your center of gravity, which is going to be over your feet. So if you're reaching forward, and especially if you have a walker around you, that could cause you to lose your balance and fall. Armchairs. You want to try and find a chair in your home that is going to be not on wheels, not too soft, and not too low. Some of the chairs that I like the best in a home are the chairs that are in the dining room that have arms that are sturdy and heavy. They allow you to sit safely, they allow you to transfer to stand safely. And you'll be able to use your arms for leverage to be able to go from sit to stand and then hold on to your walker. Moving electrical cords out of the way and keeping your paths clear of clutter is something that we talked about a minute ago, especially going into the bathroom. Take a look at your space between your bedroom and your bathroom. Make sure that that path is as clear from clutter as possible. If you can move small furniture, obviously anything that could be blocking your way, because nighttime travel from the bedroom to the bathroom can be frequent, and it could be one of those high risks of falls. Wearing proper footwear is really important. And I want you to consider when you're coming to the hospital, what you're going to bring to the hospital for footwear. You want something that's going to have a rubber sole to it, that's soft and flexible, something that you can put on and will grab your heel. You don't want to wear a slip-on shoe. Wearing slip-on shoes cause you to shuffle while you're walking, and we don't want you to shuffle. We want you to take a nice long stride, be able to hit the back of your foot down on the floor first when you're walking. So anything that is adjustable, so whether it's a sandal that has adjustable straps, a sneaker that is adjustable, you want to be able to accommodate any post-operative swelling that you might have. And the reason you might have swelling down in your foot after surgery is because that post-op area, whether it's your hip or knee, tends to migrate down to the foot while you're up and walking. And certainly we want you up and walking. So we want to make sure that your footwear is accommodating any kind of swelling that you might have post-operatively. Secure pets to avoid tripping. So being a home care therapist, I can tell you when you come home from the hospital, your animal's going to be so worried about you. They're going to want to get in between your legs and be around you all the time. And on a walker and having some pain and limitations with that surgical limb, you want to be very careful and mindful of that. So if you can secure those pets, maybe have somebody watch those pets for the first few days while you're recovering at home, that's always best. And certainly we don't want that pet anywhere near your surgical site. Post-operatively, we want that to be as clean as possible. So they're not to sleep with you in bed, or if you're resting, they should not be anywhere near your surgical incision. Secure handrails on your stairs. This is important because as you're climbing stairs, you want to be able to make sure that you've got a good grip and holding with your upper body, because again, that surgical limb is going to have difficulty ascending and descending stairs. So if you've got a full flight of stairs at home, so say you live in a colonial house and you've got 14 stairs between the main level and your bedroom level, you want to make sure that your stair handrail is secure and extends all the way up to the top of that very last step. Bathroom safety after surgery. Okay, so 2 places in your home that are dangerous. One is the stairs, the second is your bathroom. The bathroom for many reasons. Obviously, there's a lot of hard surfaces in the bathroom. It tends to be a tight area, and with the walker that takes up space, that can be challenging. The height of the toilet can be low, and then obviously you've got the whole water, soap, shower, tub issue. So the bathroom is one of those areas that we absolutely focus on post-operatively, because we want to make sure that the fact that you need to get into that bathroom several times a day is safe and secure. One way to do that is to install a handheld shower. Whether you have a walk-in shower or a tub, a handheld shower is important because we want you sitting while you're bathing. So we're going to recommend for you a shower chair or a tub transfer bench. Our occupational therapist will go over that with you. The therapist that comes to your house can also go over that with you. And I will show you some equipment a little bit later on. The next item on the list was a long-handled sponge to wash hard areas. Again, you're going to be sitting, so a long-handled sponge will help you to reach without having to bend too far forward and possibly lose your balance. Grab bars. These are very important because as you're transferring in and out of either a shower stall or a tub, you want your upper body to help secure your lower body. So you want to be able to hold on to something that can bear your weight. Towel racks do not count. Soap dishes do not count. The rail on your sliding glass door does not count. So you need to put something that is secure, that is meant for your body weight, that you won't slip off of. So those would be professionally installed grab bars if they're not already put into your shower. I'm going to show you some pictures of those a little bit later as well. Again, I spoke to the shower chair and the tub transfer bench. And then the last is the toilet. If you have a low toilet and you tend to be an average or tall person, as far as height is concerned, you want to possibly look at putting a riser on your toilet. And I'm going to talk to you about how that looks when you're sitting down and how to assess sitting surfaces in your home and what fits and what doesn't fit. So we'll address that in a minute. The next slide shows some of the equipment that I was just talking about. The first that I want to draw your attention to is the rolling walker. It has 2 wheels in the front, it has glide tips in the back. This is a hospital grade standard walker that you will be issued if you don't already have a walker. This is the walker that I described to you as being about 2 feet from wheel to wheel. And those glide tips in the back are the things that can catch your area rugs, which is why I wanted you to be able to take up any rug that you can in your home so that that walker doesn't engage that and you don't trip and fall. What's above that is called a bed rail. This is a bed rail that I like because it's easy to install. It slips between your box spring and mattress. That piece of board that you see there is particle board. It's very, very heavy and it just slides in. And the point of a bed rail is not to pin you in bed. The point of that bed rail is to help you maneuver in bed. The bed rail is no more than 6 inches in diameter, and basically it's going to allow you to go from lying on your back to sideline, going from sideline to sit, and from sit to stand. And that's really important in bed because you really don't have anything to hold on to at home trying to maneuver in bed. And with a surgical limb, that can be challenging. And again, it's very, very easy to install. What you see in a red crossed off circle is a suction cup grab bar. In my experience as a home care therapist, I have always been able to rip those off the wall. I wish they'd come off the market. I've had patients say, oh, no, it's secure, I use it all the time, but if I put enough force into it, I can pull it off. So I'd rather you have no security than a false sense of security in a suction cup grab bar. So the grab bar that you see below that is the kind of grab bar that I would like you to see installed in your shower or tub. And the longer the grab bar, the better. They come in 6-inch, 12-inch, 24-inch. So if you're going to install a grab bar, I'd go for the longer grab bar and get your money's worth because you'll have more space to be able to use that for grip. Below that's an ice pack. The reason I have that ice pack on there, that's an old-fashioned ice pack, and a lot of people have that in their home. You can make an ice slurry and stick it in there and use that to help modify your pain. A lot of pain you have post-surgically is due to inflammation and trauma from the surgery itself, and ice is a fantastic analgesic. It's your best friend after surgery. So you want to make sure you have ice packs in your home. This is just one style. The other style that I like is the gel pack that you can purchase, and the larger the gel pack, the better the surface area you can cover, and it'll help control your pain better. I always recommend to have at least 2 ice packs at home, one for you, one for your freezer, so that you can interchange them as needed. Remember, ice can burn you, so you want to be careful when you're using ice. 20 minutes on, and then you want to take it off. You always want to put a barrier between you and that ice pack. So if it's a pillowcase or if it's a kitchen towel, nothing too thick because you want that cold to transmit. Frozen peas, frozen vegetables do not work. Even if you use it one time, it doesn't get cold enough. Try putting it back in the freezer, using it a second time, it's a block of ice. So that old wives' tale, don't use that. The next picture you see on there is called a 3-in-1 commode. This used to be really popular. We used to use this a lot with a lot of our patients. The reason it's called a 3-in-1 commode is because it can go at your bedside, or it can go over your toilet, and for some of you, it can fit in your shower or tub. It's pretty wide, so I've had trouble securing it in some people's showers and tubs, depending on the width of them. This has kind of gone out of favor. It's big and bulky. As you can see, it takes up real estate in your bathroom. So with a walker, it can be difficult. You can get caught up in it. So it's not my favorite. Some people have it from previous issues, and if you have it, use it. If not, this is not my big recommendation for you. I would recommend either a riser that sits over your toilet, which is in your crams book on page 11. You'll see a toilet riser with armrests, and it just screws onto the toilet bowl. It doesn't require any tools or anything to install. It's very easy. The 2 shower chairs that I have shown here, one has the armrest, it's narrow. It's my favorite because it has a back to it, it has armrest to it, and the height is adjustable. Everything here is adjustable with push pins. So based on your height and your needs, you can adjust the shower chair to you, and it fits into every shower and every tub. It's narrow. Never have to worry about the width there. And the last one that you see on there is called a tub transfer bench. For those of you that have a tub in your home and do not have grab bars, this tub transfer bench offers that opportunity to be able to use your tub without having to step over your tub. Basically, that end of the tub transfer bench that you see sticks out over your tub. You sit down on it and you slide into your tub without having to step over or use grab bars. The one caveat for the tub transfer bench, however, is that if you have glass sliding doors on your tub, you cannot use this bench. You would have to pop those doors off, put up a tension rod, and put up a shower curtain to be able to use this type of tub transfer bench, which I recommend anyway, because it gives you more space in your tub to be able to get that surgical limb over the tub. When you have a glass door, you have a very narrow space to be able to transfer in and out of your tub. It makes it very challenging, and especially if you need assistance with transfers or bathing or getting out of the tub, it makes it very difficult for that person to assist you because it's a very tight space. On this page, you see adaptive devices. Again, this is something that Richard would go over with you while you're here in the hospital, or occupational therapist. What you see on that page are reacher, again, to be able to grab things without having to reach forward for them so that you don't lose your balance. That long-handled sponge we talked about. There's a long-handled shoehorn. There's a sock aid on there, which is a great device. You load your sock on it, you drop it down to your foot, and you pull up. Elastic shoelaces. The shoes that I talked about that I recommended for you to come to the hospital with. So if you have tennis shoes, you can replace those shoelaces with elastic shoelaces, tie the shoe and leave it tied. You're able to put your shoes on and off without having to bend over and tie or untie your shoes, because these are elastic, so your sneaker becomes more like a loafer. It works really well. On the left-hand corner, you'll see the handheld shower. This is just one style of handheld shower that you can use. There's other styles as well. This is on a bar that you can raise and lift. And again, the reason we want you to have a handheld shower is because we want you sitting to bathe. We don't want you to have to stand up and try and find your way to be able to rinse off under the shower head. We want you to be able to control the shower while you're sitting. It's the safest thing to do during your recovery. The last picture on there is a hip abductor pillow. You will only have that if your physician prescribes it. You'll come out of the OR with it, and that's only for a certain type of hip procedure called a posterior total hip replacement, or if you've had a revision, will you come out with a pillow like that. The other types of hip surgery that we do today, anterior and anterior lateral, we say that they're muscle sparing, so that these types of precautions are no longer in play. But whatever type of hip surgery that you have, your physical therapist will let you know what your precautions are. As you continue in your recovery, we would love for you to stay with us and continue with Holy Cross Health. We offer Holy Cross Home Care. Part of our home care services, post-operatively, we would have that set up through our care management or our social worker, and we would have a physical therapist go out to your home and see you for the first couple of weeks, up until the point that you do your first post-op checkup with your surgeon. If you are interested, Holy Cross Hospital and Holy Cross Home Care has paired together to offer a pre-op home safety and functional assessment of your home. This is a concierge service. It's not covered by insurance, but the hospital is sharing that cost with you as well as Holy Cross Home Care. So the fee goes, $50 is charged to the patient, and then the rest of that fee is shared between home care and the hospital. And what that does is the physical therapist will come out to your house pre-operatively. We suggest at least 2 weeks prior to surgery so that you can make the modifications and put in the recommendations that the therapist is recommending for you. And they basically do a walkthrough with you in your home, and they can specifically address issues and barriers that you might have in your home. And they'll go even from entering your home and your car transfers and any issues or needs that you might have. And you're welcome to have your coach there at that time as well, so that the therapist can address what the coach might need to do to assist you in your home. It's a great benefit. So I would strongly consider you choosing to have a pre-op home safety. Even if you're thinking that you might end up in skilled nursing or rehab after surgery, eventually you're going to go home, like Lisa said earlier. Other things that Holy Cross offers is senior fit. So once you're done with your recovery and you've been discharged from physical therapy, we hope that you have benefited from all of our services, and now you're able to go back to a level of activity that would allow you to participate in exercise classes. Holy Cross offers Senior Fit. It is a prolific exercise program. It's free to the public, and we have many, many locations. We have here what's called a hospital improvement care program, and we've applied it to our joint replacement program, which means our doctors participate in improving care throughout the continuum of care from when you first enter our doors to when you leave. And this letter that you see up on the screen now addresses that type of program and also lists the surgeons that participate in that program. Our Chief Quality Officer, Dr. Yancey Phillips, heads that program. If you have any questions about that, he's left his contact information at the bottom of the page.
Hi, my name is Ashley, and I'm the outpatient therapist here at Holy Cross Hospital, Silver Spring. I'd like to take a moment to talk to you about what the last leg of your journey will look like in outpatient therapy. Outpatient therapy typically starts after you've finished home therapy. Your doctor will write you a prescription, and you have the option to come to any outpatient therapy you would like. Holy Cross is just one of your many options. We only have outpatient therapy at the Silver Spring location. There's no outpatient therapy at the Germantown location. Once you get your prescription, you can call to make an appointment. Someone at the front desk will ask you a little bit of information and get your insurance, and then we'll get you set up with an initial evaluation. It's a good idea to remember that on the first couple of visits, most patients have not been cleared to drive. So it's a good idea to have someone bring you or arrange transportation. It's also a good idea to wear loose-fitting clothing so that the therapist can have access to either your hip or your knee. The first visit usually consists of an examination where the therapist asks you some questions. We get an idea of your home setup, things that you're having difficulty with, and what things you'd like to be able to do toward the end of your therapy. After that, the therapist will take a look at how well you're moving, your range of motion, your strength, your balance, your coordination, how well you can get in and out of bed, how well you can get up from a chair, your walking, and how you go up and down the stairs. After that, the therapist works with you to get you stronger, to get your leg moving better, to get your balance better, to have better coordination, and to get you functioning to a level that's independent. After that, the therapist usually will recommend that you're discharged to some type of community-based exercise program, whether it be at a gym or a facility, just to continue to work towards your goals.
Congratulations, you have finished our joint replacement class. We hope that this will assist you in preparing for surgery. We want everybody to have a successful recovery and a speedy recovery. There's contact information here on this slide for our director, Lisa Wishart, here in Silver Spring, as well as Elizabeth Reagan in Germantown, who was our nurse educator. My name is Laura Collins. I'm the joint coordinator. So there's lots of people to answer questions and assist you along the way. Thank you again.